Thank you, Ronald. And good evening, dear President AMSI, Dr. Manjunath Pai. I'm the General Secretary of the Executive Staff, International President, dignitaries, and members of our fraternity. Wishing all International OMFS Day. And this evening, I have been given the honor to introduce the Interstate video competition conducted among all the 23 state chapters. As our Honorary General Secretary mentioned, it was conceived by the President. This idea was conceived by the President, Dr. Manjunath Pai, and it started off with a virtual meeting among all the state secretaries and the state representatives. There were 11 topics chosen for the video, and which were cleft and craniofacial, orthognathic, maxillofacial trauma, TNJ surgery and fibrosis, mucormycosis, benign pathology and infection, oral oncology and reconstruction, aesthetic surgery, implantology, minor oral surgical procedures, and distraction, osteogenesis. And each state representative or the secretary were asked to pick one number, and all those videos, all those topics are numbered from 1 to 23. So, and each secretary was asked to pick a number from 1 to 23, and the topics were allotted based on the number that they picked. There was a virtual meeting when this happened. And there were a few guidelines. There was supposed to be only one entry per state chapter, and the video should encompass the allotted topic and theme. And the duration of the video should not exceed 3 minutes, and it should be captured in 16:9 ratio. And the file should be converted to MP4 format with a file size not exceeding 40 MB. And the last date of submission was 5th February, which was later extended till 10th February, as requested by many of the state secretaries. And the adult patient's identity was marked in all the videos, and children were exempted. And to avoid bias, we have informed all the state chapters not to reveal their identity, the state chapter's identity, nor the surgeon's identity. And the parameters used for assessment were the content of the video, the impact of the video, the completeness of the given topic, and adherence to the guidelines. And we received 22 submissions. We'd like to thank all the state secretaries, all the members of the state for having enthusiastically participated in this video competition. And also we'd like to thank, on behalf of the association, the two judges, Professor Dr. Paul Sambrook from Australia and Dr. Nitin Mopal from Mumbai, for taking the time off to judge the video. And now over to the technical team to share the videos. And also I would like to thank the other coordinators, Dr. Arjun Krishnada, Dr. Gaurav Mahesh Gupta, Dr. Pranay Pardeshi, and Dr. Alankar Saha. Thank you. Over to you, Shilpa.
Friends, this is M.S.K. Prasad, former Indian cricketer and former chairman of Senior Selection Committee BCCI. 13th February is celebrated as International Oral and Maxillofacial Surgeons Day. On this occasion, I can happily say that we are able to show all our teeth outside and smile big is just because of all of you. So have a fun-filled Oral and Maxillofacial Surgeons Day on 13th February. Have fun, guys.
Hi, an oral maxillofacial surgeon, or simply put, maxillofacial surgeon, is proficient in managing the fractures, deformities, anomalies, and the corrective surgeries of the face. Today, we will be taking briefly about the most common congenital anomaly of the face, cleft lip, and palate. Cleft of face or lip is a breach in the continuity of soft tissue as well as hard tissues of the face. In this case, although the defect is at the lip, when assessed carefully, it involves the upper jaw, palate, nose, and the facial skeleton. If not treated on time, it leads to disfigurement and functional disabilities of speech, eating, hearing, and loss of self-confidence. This can be detected during the anomaly scan at 18th intrauterine week, and the counseling for the parents by the treating oral maxillofacial surgeon begins from there on. At 2 weeks, the nasoalveolar molding of the baby begins. An OMFS surgeon, due to the extensive training in intraoral surgeries, is well acquainted with the subunits of the mouth. Study models as measurements of the oral tissues are made to fabricate the appliances which aid in feeding and future surgical procedures. At the age of 2 months approximately, the child can be taken up by the maxillofacial surgeon for repair of cleft lip. It's a surgical procedure lasting for 1 to 1.5 hours, bringing about a positive change in the child's appearance. In majority of the cases, the cleft of the lip is accompanied with cleft of palate as well, which poses problems of feeding and speech. When the child completes 12 to 14 months of age, this surgery can be safely taken up by a OMF surgeon to repair the palate and rehabilitate the speech and feeding practices of an individual. Any tissue breakdown causing palatal fistulae are repaired well by an OMFS surgeon owing to their handling of oral and oral communications routinely. These are either repaired primarily or with locally available tissues or flaps borrowed from adjoining structures like tongue or cheek. At the age of 7 to 9 years, the cleft of alveolus or the teeth-bearing area of the jaw is operated upon by an OMFS surgeon so that the teeth can erupt at this side, or an implant in future can be placed to build up the missing space. Once the facial growth is complete, the finer corrections of the lip and nose can be taken up at this stage. The facial profile of the cleft patients is disproportionate owing to the relationship of upper to the lower jaw. A surgical repositioning of either or both jaws brings about a pleasing profile and an efficient mastication system. To sum up, from the birth to the age of 20 years, 4 to 5 procedures form a part of comprehensive management of cleft deformity by an OMFS. Thank you.
One of the cornerstones in the discipline of oral and maxillofacial surgery is orthognathic surgery. Via this short awareness documentary, we aim to familiarize the common person with the scope and application of orthognathic surgery. We bring to you the daily life struggle of Shivam, a 12th standard student. Owing to his facial deformity, his classmates ridicule him. Nobody wants to sit next to him or socialize with him.
Shivam, explain what is Pascal's law.
Sir, Pascal's law.
Not only is his self-confidence and his ability to speak hampered, but because of his jaw, he can't eat properly and food spills from his mouth while eating. Tired of his ridicule, Shivam now looks for answers.
Doctor, I have a forward lower bone. It is very difficult for me to speak. Everyone makes fun of me.
डॉक्टर ये तो बहुत रोता है घर पे कुछ तो करो डॉक्टर
I'm sure we should be able to help him. Come, let me examine him. Basically what has happened is this lower jaw, the bone out here has overgrown. It's come in front. Whereas this bone has to be, this teeth have to be behind the upper teeth. I'm going to bring this part of the bone, take this bone behind so that his teeth become normal. So with this position, his teeth will come into proper place. He will be able to eat well. His speech also will improve, and I am sure he'll get a lot of self-confidence.
A forwardly placed jaw requires the interdisciplinary approach with the combined efforts of an orthodontist and a maxillofacial surgeon.
Doctor, why do I require output treatment?
We will change the position of your teeth in such a way that when surgeon does a surgery on you, you will have a very good occlusion.
A similar problem like you. This jaw is in front and this jaw is behind. We put the braces, and what we do is we make the teeth keep it in proper relation to the jaw.
Post-surgery and treatment, Shivam now has a normally placed jaw. It has increased his self-confidence and his ability to socialize. His disability related to eating and speech have also resolved. Maxillofacial surgeons have made their presence felt in all cities pan-India. They stand at the forefront at correction of facial and jaw deformities. After all, maxillofacial aces changing people's faces.
I'm so worked hard for it. I literally hope I reach there at time. I know, I'm just coming. No, I'm literally late, but I'll be reaching there by 20 minutes. Yeah.
This project is going to bring many new opportunities for us, you know. But yeah, this project manager is too much. I tell you, she's very punctual about the work time.
Yes, she is the epitome of her perfection. Whether it's her looks, work, everything just has to be perfect.
Are you okay? Let's look for a phone. We can contact her emergency number. Yes.
I'll make the call. Meanwhile, you search for the identity.
This way.
Oh, it's her, our new project manager. I'll call her parents. Guys, looking at her injury, I think it would be best if we ask for oral and maxillofacial surgeons.
Are you mad? We don't have much time. Take to the nearest hospital.
I'll accompany her and update you about the hospital. I'll ask my brother to arrange an oral surgeon there. My brother is an oral and maxillofacial surgeon, and basically an oral surgeon is a specialist for any injury that involves face and jaws. I don't know too much about this, but what I do know is that if any injury that involves our face due to any accident or any fight or any other reason, these oral surgeons can make sure that our teeth and chewing pattern remains normal, and also they maintain our aesthetics and smile as well. And I hope that you guys also will carry forward this message in future if ever required.
A 22-year-old girl was brought to us with multiple facial injuries. The immediate first step that we took was to immobilize her fractured jaw with the help of intermaxillary fixation. The fractured jaw was later fixed with the help of plates and screws after 2 days under general anesthesia. We, oral and maxillofacial surgeons, aim to restore your smile and overall facial appearance, also keeping in mind your chewing patterns and jaw functions. So next time when you see any case of trauma like this, which involves orofacial injuries, please do not forget to consult an oral maxillofacial surgeon.
I recall that day when I met with that accident. My jaw got fractured and my confidence was completely shattered. I thank my colleagues for taking a wise decision and get me a consult of oral and maxillofacial surgeon.
Today we're going to be discussing mucormycosis. The pandemic still remains on an upsurge trend. In the midst of this COVID-19 pandemic, patients are acquiring secondary infections such as mucormycosis, also known as the black fungus. The main mode of infection is through inhalation of spores, and the various symptoms include facial swelling, headache, fever, mobility of teeth, etc. Let us now look at a case of mucormycosis of the maxilla. We first check for the degree of mobility of the maxillary teeth. On evaluation, most of the maxillary teeth are found to be mobile. Sinus involvement is an important aspect that needs to be evaluated. On examination, the sinuses are found to be filled with pus and infective material. A routine preoperative orthopantomogram is taken which fails to show the extent of the disease. Radical surgical debridement of the infected necrotic tissue is done under local anesthesia. Here is the resected portion of the maxilla. Let us now look at a case of mandibular mucormycosis. The degree of mobility of the mandibular teeth is evaluated and most of the teeth are found to be mobile. Routine radiographs fail to show the extent of the disease, and hence good clinical judgment and CE-MRI are the gold standards. Radical surgical debridement of the necrotic mandible is done until fresh bleeding is encountered. Here is the necrotic chunk of the mandible. Early diagnosis and intervention are the key for a successful outcome, and we as oral and maxillofacial surgeons are proud to have tackled this disease on the front line and significantly helped in reducing the morbidity and mortality associated with it. Thank you.
Hello Raju, how are you?
I am fine, you tell. It's raining a lot these days. It's going to snow soon.
Yeah, it's going to snow, but what is this swelling on your face?
Yeah man, I got this swelling 10-12 days back. And it seems growing day by day. Tell me, what to do?
It's nothing. Home remedies will help you. Apply some turmeric and keep clove leaf in your mouth. Also do some warm saline rinses and the swelling gonna disappear in no time.
Will I be fine in 2 days?
Trust me, just do it.
Nothing will happen, right?
No, yaar, nothing will happen.
Oh, shut up, Ramesh. Stop suggesting useless things. Last year, my aunt also had such small swelling on her neck. She also tried a lot of home remedies, but nothing worked. And in the end, we had to get it operated.
Operated?
Yeah, it was a big operation that resulted in a huge scar. Let's visit to the local dispensary. The doctor there is a good man. He will surely guide us through. Let's go. Yeah, let's go. Namaste, doctor. This is my friend Raju. He has some swelling on his face and we don't know what to do.
Since when do you have this swelling?
Now it's been 2 weeks.
Did you take any medicine?
No, doctor.
Let me have a look. Array, Mr. Raju, such oral swellings are treated by specialists of dental surgery branch. You'll have to consult them.
Special doctor?
We don't know about special doctors. Yes, such specialists are known as oral and maxillofacial surgeons who treat such oral and facial swellings. One of my friend is an oral maxillofacial surgeon. I'll give you his contact. Consult him as soon as possible so that it can be treated on time. Okay, sir. Thank you, sir. Thank you.
When you visit a cardiologist when it comes to the matter of your heart, why stroll in alleys of oblivion in matters of your oral and facial diseases? Whenever you see any kind of swelling or any abnormality in your mouth, palate, tongue, neck, behind the ears, lips, nose, cheeks, or any part of face and neck, immediately consult an oral and maxillofacial surgeon. Do not let this condition take a backseat just because it's painless or seems casual. So let's join hands and educate people about oral and maxillofacial diseases. After all, it's never just a swelling.
Cleft lip and palate deformity is one of the most common craniofacial anomaly. One child in every 700 is born with this deformity. The deformity can range from unilateral, bilateral to facial clefts. Speech impairment besides swallowing is a serious problem associated with cleft palate. A good repair can restore the speech to normalcy.
இருவினை தீர்க்கும் எவனையும் வெல்லும் திருவடியை காண வந்தோ.
Maxillofacial surgeons are in the forefront of providing care and treatment of cleft lip and palate owing to the core competency and focused attention on facial structures and function.
ನನ್ನ ಮಗುವಿನ ಹೆಸರು ಮೊಹಮ್ಮದ್ ಐಮಾನ್. ಅವನಿಗೆ ಈಗ 2 ವರ್ಷ. ಅವನು ಹುಟ್ಟಿದಾಗ ಮಕ್ಕಳ ವೈದ್ಯರು ಅವನನ್ನು ಮ್ಯಾಕ್ಸಿಲೋಫೇಶಿಯಲ್ ಸರ್ಜನ್ ಹತ್ತಿರ ಕರೆದುಕೊಂಡು ಹೋಗಲು ಹೇಳಿದರು. ನಂತರ 4ನೇ ತಿಂಗಳಲ್ಲಿ ಅವನಿಗೆ ತುಟಿ ಆಪರೇಷನನ್ನು ಮ್ಯಾಕ್ಸಿಲೋಫೇಶಿಯಲ್ ಸರ್ಜನ್ ರವರು ಮಾಡಿದರು. ನಂತರ 12 ತಿಂಗಳಲ್ಲಿ ಮ್ಯಾಕ್ಸಿಲೋಫೇಶಿಯಲ್ ಸರ್ಜನ್ ರವರು ಅವನ ನಾಲಿಗೆಯ ಆಪರೇಷನನ್ನು ಮಾಡಿದರು. ಈಗ ಅವನು ಸೀಳು ತುಟಿ ಇದ್ದದ್ದು ಈಗ ಗೊತ್ತೇ ಆಗೋದಿಲ್ಲ. ಅವನು ಈಗ ನನ್ನನ್ನು ಉಮ್ಮ ಎಂದು ನಮ್ಮ ಭಾಷೆಯಲ್ಲಿ ಕರೆಯುವಾಗ ತುಂಬ ಖುಷಿಯಾಗುತ್ತದೆ. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ಡಾಕ್ಟರ್.
Besides primary lip repair and palate repair, the child will need additional procedures as they grow, like alveolar bone grafting, jaw surgeries, and surgery of the nose to reduce the stigma of cleft. Children can also have craniofacial anomalies where the head shape or the jaw shape is deformed at birth. Sometimes they can have facial growth discrepancy that is seen during birth and progresses slowly as the child grows. That also includes underdevelopment of some important structures of the face. On this Oral and Maxillofacial Surgeons Day, we wish to offer all individuals with a facial difference the best they deserve to unravel their full potential.
I can't bear this anymore, Amma. Pain is unbearable. What happened? You won't feed the baby at all. Look at the baby growing thinner and thinner every day. What can I do? I tried so hard to feed the baby. I can't.
Okay, what's your name? My name is Kishore. I'm from Shashur. Where are you from? I'm from Shashur. 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 Have you seen a steam driver?
What?
I've been browsing about your condition and I think I found a solution. Tomorrow we can see a maxillofacial surgeon, okay?
This is a case of ankylosing or tongue tie. The tip of your tongue is connected to the floor of the mouth by a band of tissue. Due to this condition, there can be several difficulties in speech, swallowing, and even lead to TMJ problems. Mothers of such infants may experience severe pain while breastfeeding. Though this is a simple condition and can be treated by minor surgery, most people are not aware of this condition and its aftermath.
So, doctor, are you suggesting that a simple surgery can correct this problem?
Yes, of course, shall we proceed?
Yes, doctor. Thank you.
Take a seat. This is a company in which we have many clients. How do you plan to manage it?
Sir, with my communicative skills.
Yes, you are appointed.
Suffering from loose dentures, which can be embarrassing many a times, dental implants can provide a fixed and stable solution for the same. All the teeth can be fixed on 4 to 8 implants on upper and lower arches, providing a fixed solution. Two to 4 implants on each arch can be used to provide stability to movable dentures. Individual teeth can be replaced with the help of implant without grinding of adjacent teeth. Patients undergoing resection of jaw for various pathological reasons and reconstruction with bone grafts are ideal candidates for rehabilitation with implants, restoring their function and aesthetic. Implants can be placed in narrow ridges with some adjunctive procedures like ridge splitting. Qualified maxillofacial surgeon is an ideal person to carry out these procedures. Small narrow defects can be managed by onlay bone graft harvested from retromolar or symphyseal region intraorally. Thin sinuses can be managed with sinus lifts carried out directly, that is lateral window approach, or indirectly by crystal approach. Zygoma implants can provide good anchorage in maxillary defect rehabilitation. Implants can provide retention for maxillary prostheses like ear and nose.
Temporomandibular joint, or TMJ, is present between the skull and lower jaw, which facilitates the moment-like opening and closing of the mouth. This joint also helps in growth of lower part of the face. Temporomandibular joint ankylosis is the fusion of this joint, which in turn restricts movement of your jaw, completely or partially. This abnormality also results in undesirable changes of facial appearance. It can happen in children as well as adults. Temporomandibular joint ankylosis can be congenital, or it can happen as a result of injury during birth, injury to lower jaw due to road accident or fall, infection of joint, or cancer. First sign of TMJ and ankylosis is patient cannot open his or her mouth. As a result, they are not able to eat, chew or speak properly. Poor facial appearance leads to loss of social confidence, which may develop depressive behavior. Sometimes the problem is so severe that the patient cannot even breathe properly during sleep. This abnormality is treated by a special group of doctors called oral and maxillofacial surgeons. They are trained to deal with all problems associated with teeth, jaw, face, and head and neck region. Oral and maxillofacial surgeon assess the severity of ankylosis through various tests like X-ray and CT scans. Accordingly, the treatment plan is prepared. TMJ ankylosis treatment can be divided into two stages. In stage 1, the fusion of the joint is released, so that patient can open his or her mouth to regain normal function, like eating, speaking, and chewing. Stage 2 is planned by the oral and maxillofacial surgeon after the patient attains the age of 18. In this stage, the missing joint is replaced, and the facial deformity caused by temporomandibular joint ankylosis is corrected. Let's hear one of our patients' story.
This is my son Tejas. From childhood, he was not able to open his mouth and couldn't eat properly. So he was underweight. Due to small jaw, he had trouble breathing while sleeping, and he could not sleep properly. We didn't know what to do and where to go. Then we met an oral and maxillofacial surgeon who guided us through all the treatment and surgeries. He is healthy now. What else father wants for a son?
Oral and maxillofacial surgeons can give a new life to these patients with correct diagnosis, proper treatment planning, and precise surgical skills.
और क्या चल रहा है?
Stop it यार. तुम्हें इस अल्सर को इग्नोर नहीं करना चाहिए.
छोड़ो ना यार तुम भी.
जो तुम इतना तंबाकू खाते हो, रोज सिगरेट शराब पीते हो, उससे तुम्हें कैंसर हो सकता है, मुंह का कैंसर. मेरी मानो तो तुम आज ही एक OMFS डॉक्टर को दिखाओ.
OMFS डॉक्टर? ये कौन सा डॉक्टर होता है?
ओरल एंड मैक्सिलोफेशियल.
ओरल एंड मैक्सिलो क्या था? फेशियल. क्या चीज है ये? क्या चीज है? आखिर ये है क्या OMFS?
Hi, I am an oral and maxillofacial surgeon. To explain in simple terms, OMFS. O, which stands for oral, maxillo, which stands for maxilla, that is the upper jaw, facial, which stands for the face, surgeon. Well, we all know what a surgeon stands for.
An oral and maxillofacial surgeon is the surgical specialist with expertise in the mouth, face and jaws. With subspecialty training in oral oncology and reconstruction, an oral and maxillofacial surgeon covers a vast array of disease processes that affect the oral cavity and surrounding structures, offering both comprehensive ablative, reconstructive and rehabilitative services. Since all the oral and maxillofacial surgeons have a blend of backgrounds covering both dentistry and medicine, we tend to have a complete understanding of all facial components and offer the best surgical treatment options, including various forms of reconstruction using various techniques from simple closure to complicated tissue transfers, including microvascular surgery. The jaws and facial anatomy can be reconfigured with a cosmetic, natural appearance and provide a proper functioning bite. Now, the common symptoms of oral cancers are mouth ulcers that do not heal, spontaneous unexplained bleeding from the oral cavity, velvety red or white patch in the oral cavity. In case you have any of these symptoms and you have a habitual smoker, taking cigarettes and excessive alcohol consumption, you should visit an oral and maxillofacial surgeon at the earliest.
Hey, how are you?
I'm fine. What about you?
I wanted to ask you something.
Yeah, go ahead.
These days I am facing difficulty in opening and closing of my mouth and I am unable to understand which doctor should I consult.
Oh, I can help you out from this. You should consult with an OMFS.
An OMFS? But who are they?
They are oral and maxillofacial surgeons specialized for treating these conditions.
Really? What else they do?
They are specialized surgeons who focus on reconstructive surgeries of the face, facial trauma, oral cavity, head and neck, jaws, as well as facial cosmetic surgeries.
Seems interesting.
Moreover, you can't even believe they treat the patients with TMJ ankylosis.
TMJ ankylosis? What is it now?
TMJ ankylosis is simply fibrous or bony union of the joint where the patient is unable to open his mouth.
But how this occurs?
There can be a number of reasons, but the most common being is trauma, and also it may occur during childbirth. In this situation, the patient has a bird face appearance, and also if we observe from the front, the jaw is deviated towards the affected side, and fullness of face on the affected side is appreciated.
Seems very terrifying. Then what's the treatment for such patients?
The treatment is ultimately surgery, and there are various procedures carried out to treat such a condition, like condylectomy, gap arthroplasty, and interpositional arthroplasty.
How such procedures are performed?
The surgery is performed under general anesthesia, incision is marked, flap is raised, and temporalis fascia is exposed. Bony cuts are given to remove the ankylotic mass. Chunks of bone are removed and a gap is created between ramus and cranium. And then, temporalis flap is deflected, rotated, and sutured in the gap created.
Then what's the result after surgery? Is the patient back to normal?
The surgery has a life-changing effect. The patient who was not able to open his mouth is now very comfortable in doing so.
This was so astonishing. Thanks a lot for giving me such a great information. And thanks to oral and maxillofacial surgeons for such a great job.
Welcome to OMFS Dental Clinic. Today we will brief you about implants.
Hello, how may I help you?
Hello doctor, I am Mr. Seth. I am having severe toothache. What should I do?
Your teeth are in no condition to save now. You have to get them removed.
What? Really? How will I eat then?
Don't worry. We have two options. One is bridge, where we will remove the teeth, after that grind the adjacent tooth and make a bridge. Or else we can go for implants.
Implants. What are implants? Is it a new technique?
Implants were first done by Dr. P.I. Brandmark in 1965. Implants are artificial teeth made of titanium which are fixed into your bone. Implants can be done for multiple teeth, as well as single tooth. Can also be done in people with no teeth at all.
I am 55 and diabetic. Can implants be done for me as well?
Yes, it can be done at any age after 16 and in diabetes also.
Is it painful and will I be able to eat properly?
It is absolutely painless and yes, you will be able to eat as before. Let me show you our patients' testimonials.
5 महीने इम्प्लांट लगवाए हैं। मैं आराम से सब कुछ खा पी रहा हूँ, नमकीन भी ले रहा हूँ, अखरोट भी खा रहा हूँ, बादाम भी खा रहा हूँ, सब कुछ खा रहा हूँ।
My wife had mouth cancer few years back. Can implants be done for her as well?
Why not? Let me show you.
मेरी 20 साल की उम्र में एक गांठ हो गई थी, जिस वजह से मेरा जबड़ा निकालना पड़ा। उस समय मेरा चेहरा एकदम बिगड़ गया था और कमर में से हड्डी निकालकर उसे जबड़े की जगह फिट किया। उसके बाद उन्होंने इम्प्लांट के द्वारा मेरे दांत लगाए और 10 साल दांत लगवाए हो गए हैं। मेरी इनसे कोई परेशानी नहीं है, मैं आराम से खाना खा रही हूँ।
Not just cancer, implants can be done in people who suffer from black fungus also.
13 अप्रैल को मुझे फीवर हुआ, फीवर के साथ मुझे कोरोना हो गया।
ब्लैक फंगस डिक्लेयर हो गया। ओरल सर्जरी हुई मेरी, उसमें मेरे सारे दांत निकल गए और दांत निकालने के बाद मुझे बहुत ज्यादा प्रॉब्लम हुई, क्योंकि ना तो मैं ढंग से बोल पा रही थी और ना मैं ढंग से खा पा रही थी। इवन मेरा 10 kg वजन भी रिड्यूस हो गया। 3 महीने बाद मेरा इम्प्लांट किया, डॉक्टर साहब ने मेरे दांत लगाए और आज मैं बिल्कुल ठीक हूँ, अच्छे से मैं खाना खा रही हूँ, मेरी वॉइस बिल्कुल ठीक हो गई है। जो बहुत सेम फील हो रहा था, क्योंकि मैं 50 की एज में 60 लगने लग गई थी और आज मैं दोबारा उसी पोजीशन में आ गई।
I am amazed I have so many friends and relatives who suffered from black fungus. I will surely recommend them.
Just like the great Dr. Brandmark said, no one should die with their teeth sitting in a glass of water.
Wow, that was some great knowledge about dental implants. I am not afraid anymore. Will surely go for implants.
I'm done with this.
Okay.
Why are you such a sleepyhead, Dad? Did you oversleep again?
No, I didn't.
No, look at your eyes, they're so puffy.
Is it so obvious? I've had this puffiness for so long. What should I do?
You can consult a maxillofacial surgeon. They do procedures to correct it.
Okay, I will consult a maxillofacial surgeon then. Doctor, I've had this puffiness in my eyes for quite some time now, and I wish to correct it.
Okay, so how long have you been having this? Is it causing any problem for you?
It's been there for quite some years now. I know it doesn't cause any problem.
Okay, so puffiness of the eyes is a pretty common condition. Almost everybody has it. It can be corrected by a procedure called as blepharoplasty.
But doctor, will this procedure affect my eyesight? And is there any chance of scarring?
No, you don't have to worry about any damage or scar formation, because what we do in this procedure is we operate in the inner aspect of your eyelid and we make sure that there's no scar formation in 4 days.
Is there by any chance that this might recur?
It has a very low rate of recurrence, and even if it does, it is easily manageable.
Thank you.
Blepharoplasty is only one of the many such aesthetic surgeries we perform. We maxillofacial surgeons also deal with many other aesthetic surgeries such as
rhinoplasty, also known as nasal reconstruction, can be a functional or aesthetic cosmetic surgery. We maxillofacial surgeons are specialists in performing such surgeries to improve its overall function and to make it more pleasing appearance.
Earlobe correction is a minimally invasive surgical reconstructive procedure meant to correct split, drooping, ripped, or overextended earlobe. It is one of the most common surgical procedures performed by the maxillofacial surgeon.
If you want a dimple, we can create one. Dimploplasty is a surgical procedure that is approached intraorally for creating beautiful dimples on your face while smiling.
Hair transplantations are done in individuals with thinning and balding. Hair follicles are obtained from the sides and the back of the scalp and placed in deficient areas. There are 2 technical procedures such as FUE and FUT. It can also be done in beards and mustache.
Lip correction procedures can be treated surgically with VYplasty as well as Botox and dermal fillers to alter the lip contour, restricting the muscle pull around the lips, thus reducing the appearance of gummy smile.
Liposuction is a surgical procedure which can also be done by maxillofacial surgeons. It uses suction technique to remove fat from areas such as abdomen, hip, face, neck and buttocks. It can also be used to shape and contour these areas.
There are many possible treatments to treat scars such as over-the-counter steroids. Surgical treatments such as skin graft, excision, dermabrasion or laser surgery are also used to treat the deeper scars.
So we maxillofacial surgeons can address all your concerns and all your needs with the aesthetic surgical procedures that we perform, and we can reach the root cause of your problem and treat you with the right procedure.
Sorry, am I late?
That's okay.
I just got stuck in a surgery.
Oh, nice. What are you again?
I'm a maxillofacial surgeon. Should I talk about cleft? How about trauma? Do you see that woman having her ice cream at a distance?
Yeah.
What did you observe?
She seems to be very beautiful. She has good dressing sense. And she's fit too.
That's where you and me differ. You know, the moment I look at her, I particularly observe her face, jaws in particular. You figure out her facial discrepancy?
No.
Let me show you. Come with me. Look here. So, this is your perception. But we look at the face. We can almost accurately guess any problem within no time. Basically, orthos means straight, gnathion means jaw, which means to bring the jaws to a proper alignment. The moment we see someone, we divide their face into 5 equal parts in vertical direction and 3 equal parts in horizontal, and that's how we measure the discrepancy. For example, the girl in the coffee shop has gummy smile, that means increased middle third facial height compared to that of the other two. So, we correct the proportions by removing the excess part of the bone and place the upper jaw in the best desired position.
I still wonder, how do you do it?
Let me show you. Look at the young male. He had to deal with confidence and social awkwardness due to his backwardly placed upper jaw and too much forwardly placed lower jaw. So we repositioned, and look at the result. He had to hide the smile before. Now, look at him. Some cases may have problem with only one jaw, as in here. The lower jaw is very much backward, and this position actually compresses the airway and causes a condition called obstructive sleep apnea, which was treated accordingly and advanced the lower jaw and the airway enhanced so the quality of life could be improved. And these procedures are not only confined to only young people, old female with biting issues, and how it got transformed like. This improved her function as well as looks.
That's really, really great to know.
The thing is, we just don't treat jaws. We treat the patients with jaws. As I said, it's all in the proportions. But adding little emotions to the proportions, we're not only changing their faces, but lives.
So from now on, if I find anyone, I will definitely refer them to maxillofacial surgeon. One quick question. Do you find any discrepancy in my... I couldn't be more proud of marrying a maxillofacial surgeon.
Have you ever felt that you have a small jaw or your face is not looking equally same on both the sides? If I say we oral and maxillofacial surgeons can correct this by making your jaws grow. Yes, this is very much possible by the process called distraction osteogenesis. So what is distraction osteogenesis? In this, we generate new bone following a corticotomy or an osteotomy and gradually distract the bone, making it allowed to grow. This is based on the tension stress principle given by the great surgeon Elizarov. He said that the law of tension stress, where gradual traction on living tissues creates stresses that can stimulate and maintain the regeneration and active growth of certain tissue structures. Regarding the history, it dates back to the Hippocrates who first used repositioning technique for bone fracture. Then in 1905, Cordovilla was pioneer to apply bone elongation, and finally came the Russian surgeon Elizarov who developed a fixator during the World War II, and this ended up in distraction osteogenesis. And in our field, Snyder in 1973 used it to increase the height of the lower jaw, and finally in 1992 McCarthy successfully used a distraction device in mandible to lengthen it from 18 to 24 mm. So the procedure includes 4 steps, namely the corticotomy or osteotomy and placement of the distraction devices. Then next followed by the latency period of several days for callus organization and gradual distraction at a rate of 0.5 to 1 mm per day. Then finally the retention or consolidation period of several months for callus maturation and mineralization, and at the last the distractor will be removed. So the application in oral and maxillofacial surgery involves in deficient maxilla or mid-face correction, then in deficient hypoplastic mandible correction, and finally in deficient alveolar bone prior to implants placement. So transport distraction osteogenesis is a recent advancement of distraction procedure in which the involves osteogenesis and histiogenesis from the residual host tissue. The gradual movement of the transport segment allows new bone regeneration formation, thus filling the defect. So the outcome of distraction osteogenesis is a useful and well-established technique for bone and soft tissue formation in moderate to severe bone deficiency cases, both in the mandible, maxilla,
COVID-19. Dark
phase of this century, which turned the whole world upside down. Yes, this contagious disease grasped the whole world into its web. The numbers started growing exponentially day by day, and death seemed to be hanging over each and every family in the country. We started seeing shortage of beds, oxygens, medications, and doctors. But these were brought under control by a group of noble people whom we later called the COVID warriors. As things started to normalize, we fell into a bigger pit. A new name appeared that formed a new fear with dangerous repercussions.
It's called black fungus.
में black fungus का केस डराने वाला है.
It is being reported in several states in India, mostly in post-COVID patients, people who have survived the virus but now face a new battle. Doctors say there is nothing to panic about, but there are a lot of questions that are floating. What's causing it? How many cases are being reported? Where are they being reported? And most importantly, is black fungus life-threatening?
As number of such patients increased, the symptoms were getting worse. Every treatment seemed failing. All medications start losing its value and efficacy, and those which worked started showing its side effects. But as we start losing grasp over the situation, the oral surgeons of the country took up the job to hold us back. They not only brought treatment and preventive solutions, but also a planned way to create awareness against this. Let's hear it from one of them.
Mucormycosis is not a new disease. It has been reported since 1885, but yes, it's not so common. And after pandemic COVID, there are a lot of cases has been reported of mucormycosis. And the spores remains in air, and after inhalation, it got stuck into the nasal lining and start invading into the blood vessels and causes necrosis.
430 plus patients which were operated surgically, for which we did bilateral and unilateral maxillectomies, avilectomies, or any other kind of surgeries. And 130 of these patients have already been rehabilitated, and the rest of them are in the process of being rehabilitated.
But I'll suggest that if you have any sign symptoms like numbness, mobility of teeth, inflammation of gingiva around, just visit your oral surgeon.
As the hope started failing, some people didn't allow the society fail, because with great power comes great responsibility.
Thank you, President. Actually, as you rightly said, the videos, everybody has put their heart and soul in preparing the videos. And so hats off to all the state secretaries, the members, representatives who have compiled this video and send it across. And these are the two judges, as I mentioned earlier. Professor Paul Samruth is the Director of Oral Maxillofacial Surgery Unit, South Australian Dental Service at Royal Adelaide Hospital. The University of Adelaide is one of the judges. And Dr. Nitin Mokkal is a plastic surgeon, is renowned plastic surgeon in the last 30 years. Mumbai was another judge. And they too informed us that it was very difficult to find out the winners, but then they managed to do it. So we have three winners to be announced, and these are the guidelines that were sent to the judges. The content of the video carried 10 marks, the impact factor 10, the completeness of the given topic was taken into consideration. The animation, technology, graphics was again taken into consideration, and adherence to the guidelines. So they judged based on this, and we have three winners now, and the third place goes to Maharashtra State Chapter. Maharashtra.
Yay!
Congratulations, Team Maharashtra. We've won the third prize, and the second prize, the second position goes to, any guesses? Rajasthan. Congratulations, Team Rajasthan. And the first prize, the first place, goes to Team Karnataka. Congratulations, Team Karnataka. You got secured the first position. Yeah. Thank you. And once again, I take this opportunity to thank the President, the Secretary, the members of the Executive Committee, and all the members for having given us this opportunity. And again, I thank the team, Arjun, Pranay, Alankar, Saha, and Gaurav Gupta for the fantastic work, and also the judges, Professor Paul Samruth and Dr. Nitin Mokkal. Thank you.